Evening to those who are joining by webcast. In the interest of keeping the day very on schedule, because we have a lot to cover, we'll go ahead and get going. Welcome back, those of you who are back, and welcome for those who are joining us just on day 2. Want to just do a very brief recap from yesterday's very productive session. It was a long day, but we covered quite a bit. Many of the steps that are involved in evaluation design we've already gotten through. We started with Simon Hurd, who sort of set a framework. We then went into additional framework and evaluation selection components in panel 1. We covered design and methodologic issues in panel 2. We talked about mapping data sources and managing data and all the multitudinous issues that go with that in panel 3. And then data triangulation methodologies when doing mixed method approaches in panel 4. So, there were a lot of things discussed. We started the morning talking about trade-offs that one has to make in designing evaluation of complex global health initiatives. We ended the day talking about how do you balance the findings, and we're going to go further into that with this morning's panel in terms of presenting findings and disseminating them. But I think the bottom line consensus from the day, and you all may have takeaways as well to share, was that we really are feeling passionate about the need to improve the way we do evaluation because the bottom line is trying to improve efficient program delivery for these important health areas and populations to improve population level health. So that's I think where the consensus lay. We certainly had a lot of discussion around method choices, universal issues around data collection and management, including financial data and the importance of that, and then various discussions around the methods for bringing together data sources in a synthetic way to yield some recommendations. But I want to just push us all just a tiny bit to remember what is the purpose of this workshop. And it's really not about looking back, although we have this opportunity to review some of the major evaluations that have been conducted recently. The goal is about applying lessons learned to future work with evaluation design. Obviously for complex global health programming, but we'll talk a little bit further today for even smaller program evaluation as well. And, I would like all the moderators and speakers and the audience as well, and that includes the webcast folks, to let's push ourselves a little bit to say, what would we do differently in evaluation design? What can we do differently or better? Okay, because that's really why we're here. So I'll just run through very quickly the day. We are going to start with our panel 5, which is about evaluation findings and communication. And then we're going to go into sort of breakout sessions. So just to remind you all of those of you who are here in the room physically, to just think through your choices. Many of you indicated some of the breakout sessions that you're interested in attending. Just to let you know, we have the one on lessons from large-scale program evaluation on a not quite so large scale. That will be held in room 6112, which is in the back there, the one that's sort of the enclosed glass box back there. Evolving methods in evaluation science. That will be held here in this room, the auditorium, and that will be webcast. So those of you who are watching will have a continuous feed throughout the day on that topic in the morning. And then we have this goal, those of you who brought your big design problem that you want to have reviewed with peers and to troubleshoot some ideas. That session will be held in the alcove there where the food has been laid out. During lunch, as we mentioned yesterday, we'd love to have everyone's active participation, where we're going to do some feedback on the workshop design itself. We have to walk the talk of evaluating our own workshop. And there will be a survey that also goes out following the workshop to all participants. We have your contact information for that. Afternoon, again, we go into concurrent sessions, so think about which session you'd like to attend. The session in room 612 in the back is about applying qualitative methods in large-scale evaluations. The session 2B in this room in the auditorium, which will be webcast, is about applying quantitative methods. And then, again, another opportunity for those of you who didn't do it in the morning to troubleshoot your own design issues. We're also going to then have a panel, final panel 6, on a hypothetical, theoretical, complex global health program that will have several evaluation experts help us design potentially an ideal evaluation for. So that'll be in this room and again webcast. We'll close out with summary highlights and reflections on key outcomes. and wrap up ideally by 5:30, if not before. And just a reminder, there will be archives of the videos, the presentations, and eventually the written summary on the website. And I do, again, just really want to deeply thank our sponsors for this workshop, Doris Duke Charitable Foundation, the Bill and Melinda Gates Foundation, William and Flora Hewlett Foundation, and the Wellcome Trust. Again, thank you also for this lovely venue in which we're holding the session. And just so you will know, we will hear from the funders of the workshop. We will hear their reflections and ideas in the final session in that panel 6. So that's our day, and we'll go ahead and get started with our panel.
Thank you very much, and good morning to all of you. Good morning. That's better. You know, I was saying yes, I think that evaluation is built into our DNA. We all programmed to evaluate. Another thing I think is built into our DNA, no one ever sits in the front row when things are arranged in classroom style. I'm still waiting to have a conference where I find the front row well populated. I thought I would have it today, but I'm disappointed. Never mind. Well done, well done, well done, well done, well done, well done, well done. Our assumption is that evaluation findings are useful. We're all here because we believe that. We believe that the evaluation findings are useful to essentially 3 communities. They're useful to the evaluator, useful to the evaluated, and they're also useful to a wide range of interested parties. But being useful is one thing, and it's not the same thing as being used. Not everything useful is used. So one of the things we look at in this panel is how does one use the evaluation findings to the benefit of those 3 communities. But if the evaluation findings are going to be useful, if a tree falls in the forest, does it make a noise kind of thing? If the evaluation findings are going to be useful, they have to be communicated. It is incumbent, I think, on evaluators to promote and to propose mechanisms to ensure that the findings are used. Because I always contend that unused findings of research, investigation, evaluation, not to use them is a travesty, is a waste of resources. I think it is unjust, unfair, not to make maximum use of evaluation findings. And we have a panel this morning that is going to lead us into thinking about how one might use these evaluation findings and how one might communicate the evaluation findings so that they're optimally useful. That is the burden of this particular panel. We have 5 participants in this panel, and the essential objectives that were set out for them is to look at the diverse uses and audiences for these large-scale evaluations. What are the potential users? Not only the sources of data diverse, but the users are diverse and the audiences are diverse, as I said, perhaps broadly putting them into these 3 major categories. The other point I hope the panelists will address is the importance of matching the message, the messenger and the audience. It is important that the 3 almost be in sync. As it is said, that communication, to use a word that is a phrase that is popular now, is fit for purpose. In other words, it is adequate. The means of communication are adequate both for the audiences and both for the type of information that is to be communicated. And also, I expect the audience, the panel will address, are there challenges? After you've had this information, after you determine it is useful, after you determine that it should be used, can you track the use of the evaluation findings? Can you determine over the course of time, have these findings been used and have they been useful to various particular audiences? I think it is interesting that this panel should come at the end of the others, because in a way, having discussed yesterday, as Ansel beautifully pointed out yesterday afternoon, this morning, having accepted the various diversity of approaches, diversity of methods, etc., now we come to, let us agree that we have a product. Let us agree how that product might be used, and let us agree that in order for it to be used, what are the best methods of communicating this particular product. We have 5 panelists. Each of them will have 10 minutes. So I hope that there will be a flurry of hands afterwards with questions for the panelists. And I must warn the panelists, if there are not questions for the audience, perhaps I'll ask you to ask questions of your fellow panelists as well. Shall we start with Bernard Nayland? Bernard Nayland is from the President's Malaria Initiative. I said to them all, I'm not going to introduce. If they wish to spend their 10 minutes introducing themselves, it's entirely up to them. They'll have no extra time.
Sure, thanks. And first of all, thanks to the organizers for having, those of us in the U.S. are happy to be out of the bitter cold here in sunny London, sunny moderate London. So thanks for the foresight of those who organized the meeting here in London. I won't introduce myself. Just want to spend a couple of minutes introducing PMI for those who aren't that familiar with it, why it was different, and why we decided, I think John Simon mentioned yesterday, we weren't actually asked to do an evaluation, but decided on our own that an evaluation was needed, why we did that, and then how we disseminated those findings to different audiences. And I'll focus on just a few of the recommendations and what we've done to follow up on those. PMI, for those of you who aren't as familiar, was launched in mid-2005. And frankly, and initially the congressional language was authorizing PMI to be $1.2 billion over 5 years, targeting 15 high-burden countries in Africa. The whole concept of PMI, frankly, came out of a lot of criticism of the U.S. government malaria program through USAID, which at the time was around $85 million of bilateral funding. And the criticism was that it was going into a lot of research, some good research, lots of meetings, lots of consultancies, lots of documents coming out, but absolutely no evidence that it was doing anything to actually turn the tide against the rising burden of malaria in these high burden countries. And also some criticism of the lack of, even though the World of Malaria was saying we're going to use all the existing tools, the single focus on the U.S. government side at that point in time of a social marketing model for ITN distribution only social marketing, never any free nets. That was sort of the mantra at that point in time. And also a total lack of any sort of interest in developing capacity for countries to do indoor residual spraying. So in the midst of all this, there were some Senate hearings, which from what I understand were quite painful. I wasn't around then. But what came out of that was this concept of the President's Malaria Initiative. And in addition to the overall target appropriation funding and the 15 countries in Africa, the congressional language also set up a U.S. Global Malaria Coordinator. All the money was to come through the USAID health accounts. USAID was to be the lead agency, and CDC was to be the main other USG implementing agency. That was about the extent of the actual congressional language. And talking to those of you who are more familiar with PEPFAR, we weren't as afflicted with as many earmarks and targets and stuff as PEPFAR was. So what came out of that, and by mid-2006, the first 3 countries started. The next year, the additional 6 countries, and about 3 years into it, all 15 countries in Africa were up and running. I came to PMI about a year and a half into it as the deputy coordinator in early 2007. And it was clear to me, again, coming a bit from outside that point in time, that this was quite different. And it was different in the sense that first of all, it was different within the USAID system. In fact, from what I understand initially, it wasn't clear that PMI would even be, because of the perception that USAID was not being effective in the malaria space. There was some discussion of maybe setting up a similar sort of malaria office under Department of State outside USAID, maybe doing something different, maybe joining it with the Office of Global AIDS Coordinator. So I guess there were different iterations of this, but at that point in time, the administrator for USAID wanted it within USAID and created some space within USAID to allow PMI to function as it presently does. That process, frankly, was not widely welcomed by some people within USAID, because basically what that did was to create quite a bit of authority in the U.S. malaria coordinator. Also a bit of consternation on the part of people that the person selected to lead the initiative was actually not a person from the Global Health. It was actually a retired Rear Admiral in the Navy, Admiral Tim Ziemer. Many of you know him. Wondering, well, why did that happen? But those of you who know Admiral Tim Ziemer, in retrospect, know why that happened. He's been a very effective leader. But you can imagine for people who spent their career in development, it was like, it just sort of like didn't understand it. And secondly, frankly, the main other implementing partner, CDC, wasn't particularly thrilled because the money all came through USAID. There was no separate appropriation to CDC. So bottom line is, it was a new initiative. The money came, there was a clear authority, congressionally mandated, in the U.S. Global Malaria Coordinator, and a clear business model as far as how the money was to flow. And also at the country level, a process was put in place, the Malaria Operational Planning Process, the MOPS, which is frankly is a lot simpler than the COPS. Those have been involved in those on the PEPFAR side. If you look at online, the MOPS are about a 30 to 40 page document. Each year the teams go in and work with the National Malaria Control Programs to try to understand what the status of the program is at that point in time. And PMI funding was always meant to be additional. In fact, one of the early criteria for being selected as a PMI target country was to have a Global Fund malaria grant. So it was always meant to be additional to other funders, Global Fund, DFID, the World Bank, and others involved in that space. Again, there were issues of some pushback. Well, I don't want to say pushback. There were people who were questioning the whole, particularly in the USAID model, where country offices, I don't want to say they're autonomous, but they have a lot of authorities to decide locally how the money's to be used and what they're going to do internally to move money. But with the PMI, it limited that authority because there was a clear mandate, there were targets set, there were interventions which were be delivered, and that money, the reporting chain, that money could not be sort of spun off to do other things, even though those other things might be worth doing. That was different and not widely welcomed early on by some of the, frankly, some of the USAID country staff. And like I said, CDC actually wanted their own funding stream. At the global level, I think there are some questions. Why do we need an initiative? Why don't they just flow all the money through the Global Fund? Like, why do you need another big bilateral funding project? And depending on your political perspective, there are others who weren't as supportive of multinational funding, saying, why not just take all the money you're putting in the Global Fund and put it into PMI? So you can imagine it's sort of like discussion going on. So in the midst of all this, PMI was set up. In each of the initial 15 countries, it is set up to have a very small footprint personnel-wise. There's 2 resident advisors in each country, one hired by USAID, one hired by CDC. And then what are called foreign service nationals. Most countries have at least 1 or 2 local staff who are hired to help manage the program. The reason PMI was able to do that is because it was set up within the USAID health office in country. So they didn't have to go and set up new offices, hire a bunch of new staff, and were able to rely on a lot of the already existing support to do that. So very lean personnel footprint at the country level. The question was, of course, a few years into this, is this actually working? And again, there's still a lot of people both inside the U.S. government and outside the U.S. government who were wondering whether or not this was really the right way to go. So even though Congress did not mandate we do an evaluation, and again, I think the thing which I find refreshing about PMI, it is a learning environment. People are willing to, well, maybe we don't have it right. Maybe this is not, maybe we should do something different. And there's also a lot of congressional oversight. I mean, Congress and the Senate, they both have malaria working groups who are very interested in malaria and are looking at what's going on, not only within PMI, but in the broader malaria landscape. So we decided to launch the evaluation. I mean, John Simon sort of talked a bit about the evaluation. And frankly, on a number of different levels, we found the evaluation very useful. The thing, as John mentioned, we asked for some actionable recommendations, and at the end of this, we were given sort of, I think the challenge with some recommendations is you get 60 or 70 recommendations at different levels, and you're then trying to figure out, well, what are we supposed to do with all of this? But the evaluation team gave 10 recommendations, 5 sort of more on the policy and programmatic side, and 5 more on the technical side. When we received the report, we did several things to actually disseminate those findings. One was we have something called the Interagency Advisory Group, which meets a couple of times a year. That includes our Health and Human Services, both CDC and the National Institutes of Health and the Office of the Global Health within the HHS. Our Department of Defense, Department of State, our Office of Management and Budget, Peace Corps. So it's an interagency advisory group for PMI. So one of the first things we did was to take the evaluation itself, this being a U.S. government initiative, and basically presented the findings and showed what was going on and what the recommendations were. Secondly, 2 minutes. Okay, secondly, we put the report out on our website. We also sent out an e-card to 27,500 USAID users. And through our resident advisors and country offices, we put these results down to the country level. So quickly, what were the responses? I'll just pick out a couple. Obviously, the one we welcome most was the recommendation that Congress give us more money and expand our geographic focus. So we welcome that, and Congress responded to that and has indeed continued to increase our funding, and we've expanded now to 19 countries in Africa and also a program in the Mekong. Specifically at the country level, which I think is where the rubber hits the road, there was first of all, some concern that our footprint may be too small, particularly as we moved into countries like Nigeria and DRC. Just having a couple of resident advisors was probably not going to be good enough, and a call for having more FSNs, which we've done. I mean, the reliance on foreign service nationals who are local, highly qualified staff to help manage these programs on behalf of the U.S. government is not only a capacity building exercise, but it actually creates the sort of stability in a program you want to see, because as expatriates move in and out of countries, these people are still there. One of the other recommendations was to flow more money through the government programs themselves. And even though we were aware that this was an issue, particularly with the quick startup to get things going, we needed to have some assurance that the money was actually going to be basically getting commodities to reach people in need. And countries are different. We all know that. So we did a sort of an assessment of that. The bottom line is, of the 19 countries at the moment, about 14 of those, more money is flowing through the local ministries of health and national air control programs. There's 3 countries where we still have U.S. government restrictions because of countries like Madagascar and Zimbabwe and Mali because of political issues. Until those are lifted, we won't be able to flow more money through there. Lastly, I'll just pick up one of the big other recommendations, which sort of came up, I think, in some of the discussions yesterday, which was around operational research. PMI, when it first got started, was not ignoring operational research, but frankly had a pretty clumsy model of doing that, and no real clear focus on leadership and a strategy for setting priorities. So the recommendation was to hire someone whose job it was to manage that, and secondly, to create some clarity around what we're doing. So briefly, we've done that. There is an OR coordinator. We have a framework. We have some priorities that have been set. And we're also, not only within the U.S. government, but talking to the other WHO, in particular, I'll be talking to DFID tomorrow and others to see, again, how our funding for operational research is actually additive and not replicative of what others are doing. So I'll stop there. Very useful evaluation, very welcome, and it won't be the last one, but I think it was a good start.
Thank you very much, Bernard. And now we'll have hear from Dorothy, who's listed as a planning committee member, but in her day job is project director of the USAID funded Leader with Associates Roads to a Healthy Future. a multi-year $200 million program. Dorothy, the floor is yours.
Thank you. That's all.
You have 10 minutes as well.
Okay, thank you. So, thank you. It's great to be here, and all protocol observed, not only in Zambia, but in most countries in East Africa, including my own Kenya. In my remarks this morning, I'll use the PEPFAR evaluation as my frame of reference, as that's what is most relevant to my daily work. As mentioned, the program I manage, Roads to a Healthy Future, or ROADS, is funded by PEPFAR through various USAID missions in Africa. And since 2005, we've been implementing programming in 11 countries in East, Central, and Southern Africa. The focus of our programming is addressing HIV and health issues along the transport corridors. And so we have the privilege of working along the main transport corridors in the region, and really looking at issues of access to HIV and health services, and also taking a keen look at what we refer to as root causes of HIV, and sometimes called structural drivers. And so in terms of programming, that's the focus of our work. Now, with regard to the issue under discussion for this panel, in early 2013, I had occasion to read the PEPFAR evaluation report and did participate as a discussant at the public dialogue session in Washington, D.C., and I appreciate IOM in involving me in that. I must say that had I not been invited to participate in the session, most likely I may not have had the occasion to read the report thoroughly, even readily access it, for some of the reasons that this panel is discussing. So, because of my participation, I read the document and was able to recognize that much of it was really relevant to my work and was very useful in strengthening the roads program. And just for purposes of framing the discussion and the conversation this morning, I thought I'd use two key examples that as a program we took and ran with and really actioned in as far as our work is concerned. So in the summary findings for HIV prevention, the evaluation recognized that interventions targeted at prevention of sexual transmission, including biomedical, behavioral, and structural interventions, are all critical components of a balanced and comprehensive prevention portfolio. But the report did recognize that within PEPFAR, there is disproportionately less program monitoring data and rigorous research evidence available on these interventions, particularly behavioral and structural interventions, as compared to the other biomedical interventions such as PMTCT and others. So as an implementer, this for me was a really stark reminder that gaps in the evidence base around behavioral and structural interventions persisted within my own program, but also across the public health fraternity, so to speak. So what did I do about this? I, along with my team, recognized that this was undermining support for these two critical elements of balanced programming, because that's always the discussion, so what? How do you prove that, the behavioral interventions and the structural interventions are actually working, and what's working, what's not? And so what we did, as a program, we did some practical and included some program aspects into our own planning. And one of the things is that we examined the association between improved economic status of households and use of health services. That's just an example of one item that we practically said we have to study this and assess this. So what we're going to do with that data is strengthen our own programming, and we'll package it for use by host governments and other stakeholders. And it has generated interest in the 3 countries where we've conducted we're just finalizing that study, in Tanzania, in Rwanda, and in Zambia. Again, a second example of the usefulness of the PEPFAR report, because I think one of the key things for me as an implementer is that an evaluation report is obviously a voluminous piece of work. And as an implementer, I'll take and choose what connects with me. And so again, in as far as the issues around gender in the evaluation report, the PEPFAR evaluation report did recognize that the gender efforts had been evolving and expanded. But again, it was what the report states is that PEPFAR engages with gender-related factors and the way they influence HIV, the epidemic and response is still more or less ad hoc. So again, this triggered us as a program to take another look at what we considered to be a really gender transformative program within the Roads Project. And since 2005, just as a background for this particular program element, at community level, we've been promoting gender equity in decision making on program design and planning, including allocation of resources. And we've been working with the communities. We are implementing the program in over 65 sites along the corridors. And we'd established gender task forces to ensure that gender issues remained at the top of the agenda in these local contexts. But we started asking ourselves, as a result of really looking at how the evaluation report spoke to us, did our local partners really have the skills and tools to sustain this work? Or was this expertise, the gender expertise, embedded within our own staffing, the staffing that are involved in ground level support at program level? So we realized that it was important for us to really look at strengthening local implementing partners so that they would be able to address gender issues which was very critical for program success and over the long term. So besides just building their skills in HIV prevention and other HIV elements and the other things that we do in terms of building their skills in program and financial management, we took a keen look at how we were building their skills in as far as gender programming is concerned. We also went ahead and subsequently we drew on our own organizational FHI 360's internal technical expertise on gender mainstreaming so that we'll be able to integrate gender into our standard capacity building package, which we've done for community partners. And this has included assessing our community partners' gender competencies, supporting them to begin developing their own gender integration plans. And this has had a positive impact in our own gender programming within the sites and the countries where we work. Now, in as far as looking at the broad issue on communication for evaluation findings, my perspective is that the evaluation findings could be even more useful if synthesized and disseminated through structured forums at the country level. And for me, the synthesis issue is critical because, as I said earlier, and that's just what it is. The reports are voluminous. It's a lot of information. It's a lot of work that has gone into the evaluation. But yet, truth be told, is an implementer going to read the volumes? Most likely not. So having ways and means of synthesizing the information and using very structured forums to be able to disseminate the information. And again, I have to say at country level, probably a lot of significant dissemination that's happened at HQ level, meaning Washington level, or if you're thinking of the Global Fund, maybe Geneva or something. But it's important that at country level, involving the array of stakeholders involved. So I'm looking at government, at funders, at implementing agencies, and even the target audiences. I think it's also important for target audiences, and I like to look at the people we work with more as target audiences versus beneficiaries. That's my own personal perspective in the way, just because I think they also would benefit from the information and the findings and the recommendations, and they would be able to link this up with the work that they do, and I think when we're talking about sustainable development, then I think there's a link there. I'm thinking that country missions with host governments through a collaborative effort can tailor messaging on findings for their local context. Because again, I think findings, recommendations, very critical, but again, they have to be contextualized. And this can help ensure that evaluation findings are used to strengthen programs on the ground. And also, I'm thinking, create a shared vision of the way forward, so that as we look at the evaluations, we are looking at a shared vision in as far as moving forward and making the recommendations come alive. I would also like to pose a question about what I see as the apparent duplicative nature of these large-scale, complex, multinational global health initiatives. I think that since these initiatives are implemented in the same countries many times, they are subsets where, because therefore the context is the same. I'm thinking that PEPFAR is implemented in Kenya, PMI is to Global Fund is, so there's a conglomeration there. So my question is there an opportunity for more collaboration evaluation effort, including in dissemination of findings? Because I'm just thinking that, okay, you have a dissemination of a structured way in which you're disseminating PEPFAR findings, and then another meeting in the same country for Global Fund, another one for PMI. Is that useful? Is that necessary? Is there an opportunity for coming together? And I appreciate that the complexity on the operational side would be real, but I also think that to draw on existing synergies and to sort of, the analogy for me that I look at is really the left hand knowing what the right hand is doing, and creating synergies that would probably push the usability, the use of the findings. So regardless of the complexity, I think the gains would be significant on the findings of using the findings and countries connecting with the key messages. So in summary, I have to say that evaluation reports such as the PEPFAR report contain highly relevant and useful recommendations and conclusions for implementers. No doubt about that. The PEPFAR report, for example, includes critical information for any implementer of HIV programming, regardless of the technical area. But with information overload being an ever-present challenge in our world today, I think the public health evaluation community must engage audiences in ways that cut through their own clutter, and whether we're thinking of individuals, whether we're thinking of organizations, institutions. Therefore, identifying and developing strategies to make this information easier to access, digest, and act upon, for me, is a critical step for consideration going forward. Thank you.
Thank you very much. And now we thank you very much, Dorothy. Now we hear from Ian Goldman from the Department of Performance Monitoring and Evaluation of the Government of South Africa. Ian.
Hi, welcome. It's good to be here. I was here on holiday and was asked to come and said, okay, I can pop in for this panel. So I'm here with you. So my name is Ian Goldman. I'm a Deputy Permanent Secretary in the Presidency in this Department of Performance Monitoring and Evaluation, which is specifically targeted with this mandate around monitoring and evaluation, and mine is particularly my responsibilities around evaluation. And I'm going to give a rather different perspective, I think, than the sort of other people perhaps seeing the other presentations that have happened, because I'm coming very much from a country perspective and how you influence policy and how you get change to happen and how you improve service performance, etc. First, I mean, I think one thing is that our department was created only 2.5 years ago, following an election where we got a new president, President Zuma, and with a very strong mandate to try and improve services. And part of the way this was taken up was the importance of M&E as part of a public sector improvement process. And so the department was created 2.5 years ago, so everything's very new, but it's been extremely dynamic. And one of the things about South Africa is that things can happen quickly. We had a national evaluation policy approved in November 2011. One of the aspects of the change in the creation of the department was also that there was very much a focus on outcomes, that we wanted to try and make sure there was a difference in the experience of people, and not just to get sucked into the technical modalities of government. And evaluation was seen as part of this, to try and make sure that there was really an impact happening in terms of, yes, the way the services perform, but also in the way the benefits that accrued to people on the ground. We built on international experience, particularly from Mexico, Colombia, the US and Australia, but also other African countries, including Kenya. And we're currently at the stage where there are 38 evaluations that are completed, underway or starting, representing several $1 billion of government expenditure. So it's quite significant scale. And there's a small unit of 15 staff in the presidency which is responsible for leading the system. And we work with the M&E staff in government departments as well as program managers in government departments. The focus of the system is on improving program performance and policy performance, on accountability, on improving decision making, and also on improving the knowledge base in government. And one of the key aspects about the approach we're taking is a focus on utilization. So we're not interested in reports. Reports that don't make a difference are a waste of time. So there are certain things which result from that. The first is that we've got very much a learning focus rather than punitive. Most M&E is done for compliance, and we're having to try and change the culture to make sure that evaluation is used. So this means particularly trying to get ownership by departments. So evaluations are not at them, but they're things they want to do and that they want to implement the findings. So we get them to propose the topics. We also do an improvement plan once the evaluation is completed, and that is monitored for at least 2 years to see that things are happening as a result. We're also doing work on the demand side. We've been training permanent secretaries and the senior management teams of departments on evidence-based policy making, and we've also been doing training with Parliament. As an incentive, we say the incentive is your learning, because at the end of the day it's for you to improve your own performance and you'll benefit from that, but we also offer 50% of the cost of the evaluation from the presidency. We focus as much on the process as the product, because again a good product with a poor process the evaluation will not be used. So it's very important that the process is good, the ownership is there, etc., etc. We're realistic about capacity. Capacity in South Africa is limited, so we're being strategic about evaluation. We're focusing initially on 15 priority evaluations per year, which are based on an annual call for evaluations and what we call a national evaluation plan. And all these documents, by the way, are available on our website. They're quite high quality documents and they're worth looking at. We're trying to create this as a cross-government system. Being in the presidency has advantages but also disadvantages, because there can be quite a lot of resistance to you. So we're trying to create widespread ownership across government with an evaluation technical working group which involves people across government, and it's that group which actually selects the evaluations, it's not us. We're also seeing evaluation as happening at all stages of a program cycle, from what we're calling diagnostic evaluations before an intervention starts, through design evaluations, implementation evaluations, impact evaluations, economic evaluations, and what we're calling evaluation synthesis, based on the systematic review idea. Evaluations, to promote independence, the evaluations are undertaken by service providers. We have a steering committee representing key stakeholders, including the custodian department and ourselves, but potentially other departments or stakeholders. To try and get quality, we've developed evaluation standards, evaluation competences. We have 18 guidelines, we have 5 sets of training, we have peer reviewers, and a DPME evaluation director as part of each of the evaluation processes to make sure it's done well. We also do a quality assessment a month after the evaluation is completed based on the standards, and all the reports will be available on the website as soon as they've been to Cabinet. That's another thing, because our focus is on strategic evaluations. The plan is approved by Cabinet and all the evaluation reports will go to Cabinet. So there's a high likelihood of policy impact from them. We do also have a focus on communication. Most evaluation reports will be in the 100 to 200 page range. I've even had a 500 page one. But we say to people they have to produce a 1/5/25, so it's a 1-page executive summary, 1-page policy summary, 5-page executive summary, and 25-page main report, which is a lot of resistance to, but it's essential. Another focus is on transparency. All reports will go on the website, and once it's been to Cabinet, the terms of reference will go up, the key independent interim reports will go up, the final report will go up, the quality assessment will go up, the improvement plan will go up, as well as the progress report, so people can track what's happening. And we're gradually we're beginning to get quite a significant number that are underway. We're beginning to move from this focus on the 15 a year to trying to get departments to have their own evaluation plans and provinces to have their own. We're in a semi-federal state, so provinces to have their own provincial evaluation plans, and we're progressing quite well with that. In terms of the global evaluations, obviously, I mean, there's a challenge for us as how one of our policy, which is again worth downloading, I think, says the donors should follow the South African system. Now, if you've got a multi-country system where you've got your own ways you want to do it, but it doesn't necessarily match the way our country system, how do we match that? One of the things we're trying to do, for example, in our system is to try and get standardized terminology. So, you know, every evaluation FADist has got their own terms they like to use and their own, you know, whatever it is. So we're trying to get some standardization to try and help make it easier within the evaluation community in South Africa. I think in terms of the National Evaluation Plan, there's an opportunity to include global evaluations with their country components as part of the national system. And even if they're not locally funded, there is an opportunity for profile because the reports will go to Cabinet. And that's quite an advantage. But however, there are some requirements to follow the South African system. And for example, we're working with 3IE. By the way, I'm also on the board of 3IE. 3IE, the International Initiative for Impact Evaluation. Okay. And there we're saying, yes, we'll follow your systems, but you've also got to follow ours. And so it's trying to work out how to mediate that. There's certainly an opportunity to learn from global evaluations and evaluation synthesis, and that we haven't done an evaluation synthesis yet. But for example, one of the things we've done is we've done an audit of all the evaluations we could find across government, where we could actually find the reports, which is not as easy as you think. And we managed to get 130, of which we've managed to finally get about 85 where we had reports. And we've done quality assessment of all of those, and so 70 of those passed and are on the website. And so there's potential to do synthesis now across some of those. There's also an opportunity for global evaluations to be included in departmental evaluation plans and linked to that. And there's an opportunity for us to co-fund them. So, I mean, certainly in a South African situation, there are local funds that are available. So I would recommend, if you're interested, go to the website, which is www.thepresidency-dpme.gov.za. And if you go to the focus area evaluation, there's all of our stuff's up there, and you can access, including the reports as they come through. There's only one that's been to Cabinet so far, which is up there. Thanks.
Very good. Thank you very much. Thank you very much, Ian. Now, last but not least, Kimberly.
Thank you.
Not because you're a planning member, you don't have extra time.
Hopefully I can make up some time, and what's not covered in the presentation can be covered in questions. But in full disclosure, I am the study co-director of the PEPFAR evaluation for the Institute of Medicine. So I'm going to talk more about the actual activities that we did to try to I think follow a lot of the very good advice in the BE framework in terms of designing a communications and dissemination plan and ensuring accessibility to the findings of the evaluation, with all of our audiences trying to figure out ways to make all of that information digestible and then ultimately supporting the use. The Institute of Medicine actually requires us, when we do consensus studies, to do a communications and dissemination plan. And a lot of the resources that are for that dissemination are actually included in our contract for the evaluation, and we actually have to do some consultation with the sponsor, and in this case, the Office of the Global AIDS Coordinator, about the dissemination activities and what it is that we had planned. But in terms of the audiences we had, very diverse audiences from Congress and the Department of State and the Office of the Global AIDS Coordinator, and implementation agencies, PEPFAR implementation agencies, and implementers at all levels, others involved in national and global responses to HIV, and of course the general public. And I think that part of what our strategy was really from the very beginning, as we were thinking about what these activities would be, was really trying to focus on ensuring accessibility and use. I think our activities focused into sort of three main buckets. Some of it is just a variety of reports and the report products. So everybody's been talking about it, and we've been showing you the 3.5-pound book that we produced that was disseminated in a number of different ways, including it was available free in electronic format. There was also a 20-page summary or executive summary that at least outlined all of the recommendations of the report, of which there were about a baker's dozen. Then there was also a 4-page report brief or policy brief that we used. So in many instances, we kept trying to distill what the key messages were for the various audiences. We also did a lot of in-person briefings and disseminations on the findings, which we found to be pretty key. And there are some requirements. Of course, we do some pre-release briefings. And by pre-release, I mean before the report is publicly released. There is a pre-release briefing for the Office of the Global AIDS Coordinator, which is directed primarily for the sitting ambassador, who was Ambassador Guzmi, and all of the technical staff that were invited. That was done immediately before the release of the report. We're also required, when we have congressionally mandated studies, to do briefings for congressional staff and for the committees that were the committees of jurisdiction and appropriation, and then any other committee that was actually interested and requested briefings, and we did several of those. I think one of the most interesting and important briefings that we did, and it sort of goes to being able to really communicate in great depth and in technical detail, were the briefings that we did for PEPFAR implementing agencies, which we call technical briefings. And so we did those for USAID, CDC, and NIH. And part of what we learned was that after we issued the report, Ambassador Guzmi actually required a written response from all of the implementation agencies to the report for its findings and recommendations. And while that was not going to be for public distribution, that was one tool that he was using to be able to sort of break down and digest what was relevant in the report, and being able to talk about it with the implementation agencies and their technical staff and how they were going to go about and use the report. Some interesting characteristics, I think, about that implementation briefings is that the staff of the agencies were instrumental in establishing the agenda. So not only did they get an opportunity to prepare written responses to the findings and recommendations, but they also had an opportunity to pick the technical areas that were most relevant to them and be able to talk about that in detail. And we were also able to talk about the recommendation considerations. That's one of the things, the difference between the 850-page report and the summary, is that we recognize that a lot of the recommendations required some careful thinking across technical areas, across agencies, but it was an opportunity for them to be able to ask in great detail with some specificity and be able to talk with staff and committee members about what those considerations were and how they could actually implement them and what would be actionable about the recommendations, and drill down for content on all of those findings. We did 2 public briefings, and we did the first when we released the report, but then we strategically did another one several months later that Dorothy talked about, at which she was a participant, because we knew that people would need time to be able to digest the information of the report and actually be able to have some meaningful dialogue. So we actually did that a couple of months apart. And invited a number of different stakeholders. For both of the public briefings, they were both webcast. They were globally webcast. And so when we had limited resources to actually be able to disseminate this in the way that we thought would be appropriate and digestible and reach everyone, we did try to focus on bringing some country-level participation. And so you heard from Dorothy that she participated. We also had participants from Kenya, Malawi, Guyana, Tanzania, and looked at a variety of stakeholders, whether it was from representatives from the NAC, CCM representatives, clinical providers, other providers of PEPFAR. So we were at least trying to figure out ways that we could send some of the messaging to the country level, not just have it be sort of passive in webcast, but active participation in the briefing. But we certainly appreciated the feedback of how it would be more useful to talk about it and digesting information and being able to package it for use and interpretation at the country level. There were also a number of invitational events where we did either a presentation of the report and its contents or on the methods. Some of those were domestically focused, some were focused on funders concerned about AIDS, and so it was an opportunity actually to educate a lot of donors who were not only domestically focused but also internationally focused on some of the salient issues around the report content. We also were invited to do a presentation on the methods at the UNAIDS MERG meeting this past year, so that was a way for us to be able to share that information with multilateral organizations, but also hoping that it would also be incorporated into whatever technical assistance that would be given countries in terms of their monitoring and evaluation frameworks. There were a number of other types of meetings, scientific meetings, the Consortium for Universities for Global Health annual conference, where a number of the committee members and staff did presentations on the methods and the findings. We also presented at the annual Qualitative Research for Health conference in Nova Scotia this past year on qualitative methods. So we really tried to find some very large sort of venues to be able to disseminate information, as well as trying to package and narrow down from webcasting to in-person events to focusing on implementers and how much we were able to provide the right level of information and be responsive to the queries about content and the implementation of recommendations and their considerations. There were a number of also written perspectives or publications. Bob Black, our committee chair, wrote an editorial for Lancet. We also had a lot of blogging that was done by the Center for Strategic and International Studies, as well as for the Center for Global Development. And some of the web-based things that we did, we tried to do some things that were a little bit different, that could be informational not only in terms of HIV disease and from education and providing global epi-picture. We created a quiz that was identified and put on our project webpage, and that was really sort of focusing on disease education and trying to provide a global epi-picture. We also created an interactive experience, or an IE, that is on our evaluation webpage. And that IE did two things. And one, it had a descriptive function in terms of actually describing what PEPFAR does. So if you could imagine taking sort of chapters 3 and 4 of that report and trying to really give everyone in the general public and anyone who would click on an idea of not only the structure of PEPFAR, but the types of services that it provides, and what an experience might be in one PEPFAR country in terms of trying to access prevention, treatment, or care services. But really invite you to go to the website, www.iom.edu, to take a look at that interactive experience. And I will stop there and see if there are questions that we can talk about a little bit of the use and how we're trying to track that formally in IOM.
Marvelous, marvelous. Thank you all very much. Thank the panel very much. You had a very disciplined panel. We have a very disciplined audience, and I'd like to entertain any questions to the individual panelists or general. Please. As usual, would you identify yourself?
Hi, my name is Emily Stammer. I work with the John Snow Institute for Research and Technology with the Center for Health Information Monitoring and Evaluation. And my question was exactly what Kimberly mentioned, was essentially what mechanisms do PEPFAR, PMI, especially have in place to track not just the dissemination, but the use of these evaluation findings?
That question was not planted. Please. Please. Hey, right here? Yeah. And then Cara.
We have one in the back.
Okay, one small question. Could everybody give an indication of the budgets available for these activities, or percentages of the general budget? And secondly, I was interested by what Dorothy was saying about involving local communities more. If the others could reflect on how that could be done better in their particular cases, I would appreciate that.
Thanks very much.
I'd like to comment on this issue of resources, but also to sort of step back and think about different stakeholders in the evaluation and their incentives for dissemination and the audiences that they're particularly interested in reaching. And it strikes me, certainly from the experience of the AMFM evaluation, that the Global Fund, as the client, was particularly interested in their own internal processes, making sure that the results were disseminated through the committee structure that would feed up to the Global Fund board decision. The country teams were really concerned with making sure that the national stakeholders were reached and the results shared with them. And the sort of evaluation team had an eye on sort of a different audience, probably so the sort of the global research community, and we're interested in conferences and in and making sure the results were available at that level. And we never had a communication plan or a requirement for a communication plan, and there was no resources whatsoever in the budget for communication, other than for the stakeholder forum, which I would say was a little bit about communication, but also partly about validation. I wouldn't really call that a communication event. And I think it's a very, very important issue to make sure that the resources are available and that people anticipate and plan in advance in a way that we know is best practice in research uptake.
I think it's an excellent three group of questions. I think they have salience for each one of our participants. Would you like to start, Dorothy?
Okay. Okay. Although I think you wanted the other members of the panel to comment, yeah. But I think I totally agree with what you're saying, and probably it feeds into Kara's point just now about definitely there are different incentives, needs, focus of each of the participating each of the participants in the evaluation, and probably then in the same way that we are as evaluators really keenly interested and nailing down the whole design process and all kinds of things. In as far as the technical aspects of the evaluation, probably this whole aspect, communication and dissemination and use, is something that then needs to find its way with the same seriousness in the technical aspects of actually getting a sound evaluation findings. And therefore, and I think what it would require is some real deep thinking and interrogation and figuring out, okay, and also being very candid and because truth be told, yes, different participants in the evaluation will have different needs and different audiences that they want to pass these messages to. And so really looking at that very deeply and interrogating that, and then having a plan even prior to the findings, so that then, because I think also one of the realities is that, and I'm thinking about country context, that depending on what the evaluation looks like, and that's I could draw from John's statement yesterday about beating concordance from discordance, something like that. That could also influence the audiences that will need to be reached. So I think important to really consider these things up front, this whole communication and dissemination up front, and then figure it out and implement it.
I'm going to ask in sequence Bernard, Ian, and Kimberly to reflect on the other three questions. The budget, what budget is allocated, mechanisms for tracking, and the incentives for audiences. Bernard, do you want to begin?
Sure. Well, the budget that's an easy answer. That was $500,000, and it was very good value for money in the scheme of things.
Total budget of?
The evaluation itself, out of a total budget in 2011, the overall PMI budget, because it's annual allocations, PMI, was around $620 million that year. This year we're $650 million. So, but I'm not sure where that goes, because I don't know if there's supposed some target percentage for an evaluation. But again, the sort of evaluation that John and his team did was, I think, quite a bit different. Subsequently, one thing I'll just say is that I think, and I saw this because I was very familiar with the Global Fund evaluation, sometimes trying to throw impact evaluation into the mix at the same time you're doing evaluations of sort of approaches and business models, and that can, it's not surprising that frequently that ends up becoming one of the most perplexing parts of an evaluation. One of the recommendations which came out of our evaluation, which we were welcome, was to basically accelerate the impact evaluation piece of this, and we've done that. You know, when it comes to impact evaluation, I know that our colleague here from South Africa, I didn't realize there was the 3IE, but I'm interested to find more about that. When it comes to impact evaluation, I think that's the one area where frequently there's, as one of my colleagues once said, premature evaluation. That people go in and try to look at impact before there's actually any evidence that programs have scaled up to a point where you would expect to have impact.
Tracking?
The tracking, well, we have a tracking sheet for some of the recommendations. Again, we have 10 primary recommendations are things like our OR strategy. We need to relook at the IRS. These are the sort of the technical things. That's been done. Some of these other issues which have to do with flowing more money to countries, that's an ongoing issue, and frankly it's part not only of PMI but the whole USAID forward agenda, which is so we have a tracking sheet. A lot of what the recommendations ask us to do we've done, and some of it is ongoing work. But I go back to the impact evaluation because there is now in-depth impact evaluation which has been conducted. Tanzania was the first country, but Rwanda, Senegal, Ethiopia, Angola, Malawi, that's an ongoing piece of work. And that's where a lot of the audience is actually at the country level. And the way we do that, engaging the local country partners and capacity building, and the dissemination is at the country level initially. But we can talk a little bit more about that. I just think that the impact evaluation sometimes ends up getting mixed up with everything else, and it's actually a different piece of work.
Ian, you wanted to comment on those three issues?
Just on the budget side, our evaluations are costing between $150,000 and $400,000
a year
for each evaluation.
For each evaluation, and you how many a year?
We're focusing on 15 a year.
15 a year, $400,000 each.
Up to $400,000 depends. Just to talk about.
That goes to dissemination.
At the moment, there's no percentage on it. At the moment, we're funding the dissemination as additional activities, but it's very much that's embryonic. The dissemination we've definitely got at the moment is briefings of parliamentary committees, media briefings after the report goes to cabinet, and we are planning to do policy briefs. But there's much more work needed on targeted marketing there. Just to say on the impact issue too, that there's a big issue around people wanting to do impact evaluations. They actually don't have the data. So we often, people come asking for impact, and we then say, let's actually do what we're calling an implementation evaluation, which is more of a process evaluation, to try and see how the intervention is working and use it to plan actually doing an impact evaluation and what data actually needs to be collected for it. Tracking like Kimberly mentioned, we have a requirement that departments produce what we call a management response when the evaluation is produced, and that also goes public. And then, as I mentioned before, an improvement plan which is then tracked. In terms of involving local communities, well, it depends on the evaluation and what it's trying to do and the questions that are being asked.
Thanks very much.
How we track use of findings, yes, I will say this, it's being webcast. The IOM has a very limited ability to formally track use of findings and impact of findings. And there are certain metrics that are available, but if your study actually doesn't, if any of your recommendations don't match those metrics, then it makes it sort of hard to track. For example, it looks at changes in legislation or it looks at changes in funding, neither of which this evaluation was designed to do, intentionally not focusing on reauthorization because the timing wasn't necessary, wasn't possible, and nor did we talk about funding, and that was part of the mandate. But But what we actually do as staff is that we actually do a lot of environmental scanning and do some follow-up with some of the implementation agencies to find out how they're using it. We actually have gotten some very specific feedback that some technical areas will now be focusing and changing their indicators to do outcome measurement as opposed to outputs and start to do some age disaggregation of data. So when we are able to attend those meetings, either we are invited or we're following them because we are interested. That's really the way that we're sort of monitoring, as well as having some ongoing relationships with people in the implementing agencies. In terms of the budget, we have some of these activities that I described are core activities that you'll get with any study. So you'll get a sponsor briefing, you'll get a public briefing, and you'll get the congressional briefings if they're congressionally mandated. A lot of the extra activities we talked about, the technical briefings, they were all requested by the implementation agencies, and we accommodated those. The invitational events, and the way that the Institute of Medicine works is if any of these events happen outside of the close of the period of performance, essentially it's been volunteer time for Bridget and I and a lot of the committee members to still go and talk about the methods, try to disseminate the findings. So as a percentage of the budget, I would say it is extremely small. And we really sort of start spending that as we get towards the end of the evaluation. The interactive experience that we did, we actually went and competed for internal communications funds of the presidents of the national academies to do that. So that was outside of the budget. And the incentives for audiences, I think it depends on what where does their interest lie in terms of the whole PEPFAR issue. If some were interested just in terms of reauthorization, a lot of people were sort of disappointed because the recommendations really were done with an eye of not requiring reauthorization of the legislation. So many of them were all administrative and technical. We do know that there's also been some use by advocacy organizations because of invitational events that they've invited us to that sort of look at the policy change over time and what recommendations that we've made or how we've identified importance of policy. So,
thanks so much. Margaret, you wanted to have a question?
Let me start back here. Thank you. Anna Hentinen from DFID. I've got a question about the impact evaluations to all the panelists, particularly to Ian, I suppose. Given your reports go to Cabinet, do you have evidence that there has been a policy change coming out of the evaluations that you've done? Second question is about the communications throughout the cycle of the evaluation. Lots of discussion has been about dissemination communication after the evaluation has concluded, whether any specific plans for sort of continual communications have been included in PEPFAR or PMI evaluation, and whether there's been any political pressure for sort of good news stories or short-term results before the final evaluation findings have come through. Or perhaps this has not been an issue, but I'd be interested in it and all the panelists' views. Thank you.
Yes. Margaret?
Thank you, Margaret Crook from Columbia University, and thank you for this wonderful panel and for the examples of dissemination. Actually, my question picks up right where that previous comment was, which is dissemination strikes me as having two purposes. One is for maybe more, but accountability to the public and stakeholders certainly. But the other is the influencing translation, right, of results to the implementers and hopefully change and improvement in programs to the benefit of the population served. And I guess I would love to hear, yes, examples of how evaluations have actually shifted things, because we know evaluation results are not the only input into policy and programming, but also best practices for how evaluators can assist that process from the beginning. I think it doesn't start at dissemination, and this has already come up. How do evaluators help build? So sometimes an evaluation is commissioned, but it's sort of a passive process alongside. How can evaluators support the use of results?
Thanks very much. Let's have the third question here. I'm
Hi.
Sorry,
That's
I don't
not
have
a
a
problem.
natural indication to the right. I don't.
I don't know why, because the left is very interesting. But I'm Tessie Katsambas. I'm the president of Encompass LLC, a company in Washington, D.C., and very active internationally on the IOCE board, the International Organization for Cooperation and Evaluation, and an initiative that comes out of that with the United Nations and now many other members called Eval Partners, where South Africa and your colleague Jabu have really been leaders in promoting an enabling environment for evaluation. So I was very struck by the panel, how all the different stories tell us about how it's very important to think about who has responsibility for dissemination, who has responsibility for use. And I feel that we have been asking the panel a little bit, and this session has been focused with an assumption that, well, the evaluators are responsible for dissemination. And in fact, it feels to me from the reality of managing a lot of different large evaluations that that's not always the case. And so I wanted to think about these issues of capacity, like South Africa has a high level, is rapidly developing a high level of capacity. And so the responsibility is clearly with the government about what will happen. And then we have the example of PMI, where I saw the puzzlement. Budget for evaluation use, well, I mean, they wanted it. So automatically, use was built in from the beginning because they wanted the evaluation. And then sometimes evaluation was a little more distant, and so on and so forth. So dissemination itself should not be assumed that it's something that we have to spend a lot of money on. It depends on what we want to do. And it feels like PEPFAR has had a really deliberate strategy for dissemination. And it'd be interesting to know what the goals of that dissemination plan were, and to what extent those goals have succeeded. I don't presume to know what exactly they are, but obviously it's been a very high-profile issue. So I'd love to hear from the panel any insights about this issue of who's responsible for dissemination, who's responsible for use, and then what in the evaluation process, in your experience, has encouraged it? Thank you.
Good. I think those are three excellent questions. Would anyone like to, was there 3 or 4?
There are 4.
I've lost count. We have a first round answering those 3, then we'll come to another 3. You want to?
Sure.
Don't delve into the minutiae impact evaluation.
I'd be happy to do that. No, just well, first of all, the PMI evaluation was 7 months, and there was an initial inception report which helped sort of frame that for the evaluators. So the issue of how we track that going forward, were a couple of PMI staff who basically were the focal points for the evaluators and would reach out to countries to frankly assist and sort of report back to the PMI leadership on what the status is, or the timeframes being met, that sort of stuff. But that sort of evaluation, I think, was quite different than an evaluation that takes place over several years, a little more refined. I think the question of how evaluators can support the actual eventual use gets back to this idea of, well, what is an actionable recommendation? Having lots of recommendations which are maybe and sometimes self-evident, or maybe sometimes, well, that's kind of nice to know. It's not really, it's hard to know what to do with that. Whereas if it's actually, taking a finding and actually turning it into a recommendation which may or may not get traction, I think, is something evaluators really need to have some experience with doing. How do you actually phrase that in a way which is actually usable for those who are then supposed to follow up on this? And I think John and his team did a very good job. And then last, I think the other question, who has responsibility? I think maybe I was just naive, but I just assumed that we had the responsibility for figuring out ways to get the recommendations out there, both through our Congress and Senate, but also internal to the U.S. government, and also flowing down to the country level, and also through our global partners, the RBM, Global Fund, and others. So I may have been a little naive. I just assumed that was the responsibility of those who actually are those who are supposed to use and make use of the recommendations.
Shall we go ahead, Dorothy? You want to comment on this?
Yeah. I think, these are really insightful questions. I think that the issue of who has the responsibility for use and dissemination, and I like the idea of that continual dissemination during the evaluation. I think the whole issue of stakeholder engagement throughout the process, and probably even prior, because these evaluations, when we look at them, they are evaluating real human and social issues at the end of the day. So helping people, the people who are implementing the programs, really see that there is a definite link between, and an important one, between what the results of this evaluation will show and improving the implementation of the programs, which are addressing real challenges, real social and health challenges. So making that link, because I think sometimes what happens is that evaluations in and of themselves, sometimes they are, they can tend to have the face of scrutiny that is simply coming to look at what's not working, what's wrong, and therefore people need, sort of, oops, I need to really show that everything is working well. But a deliberate stakeholder engagement at every level, at country level, at fund level, etc., so that there is a real recognition of the fact that the results and the findings and the recommendations coming from this piece of work are going to be really critical and in helping us make this a better piece of work. So wrapping that up, I think, is crucial. And therefore, I think the whole it's really a collaborative effort, and probably, yes, distilling from the fact that it's not just the role of the evaluators to then decide, okay, how exactly, and to be questioned, how exactly did this evaluation, how are the findings being used? So collaboration, stakeholder engagement are key.
Yeah, the issue of cabinet was mentioned specifically, and did things change as a result of your presentation to cabinet, presentation of these plans? That was a specific question. Do you have any reflections on that?
Yeah. So one of the evaluations is not an impact evaluation, not yet gone to cabinet, but it's had an immediate effect. So, for example, we've done an evaluation of the reception year of schooling, which has been introduced as a way of trying to reduce educational disadvantage for poor children. And actually, what it's finding is it's not having the impact it should have. So, for example, in our National Development Plan, we had a plan for 2 years of reception schooling, and we've immediately dropped that. We're saying we've got to...
What is the life rate? Kindergarten. Oh, okay.
Yeah, sort of between kindergarten and beginning of primary school. So we're saying, no, we've got to up the quality. So before we do 2 years of more schooling, we've got to get the quality right. So that's an example, but it's early stages for us. We've had the first 5 evaluations have now just completed relatively recently. And on early childhood development, which was completed a year ago, there's one of the key findings there was that early childhood development should be looking at children from conception, not from age 2, which is what it was previously doing. And so there's a policy review happening of the Children's Act to try and see how it should be amended to include from conception. So those are examples where there has been change. In terms of the communication through the cycle, I mean, I think, well, one thing that just strikes me listening to you talking is you're very much talking as outsiders trying to influence. Whereas, of course, in our case, what we're doing is we're trying to work with the people who need to learn about what to do differently so that they are the owners of the process. So the dissemination is not disseminating to them, they're part of the process. The issue, there is an issue in some cases of dissemination to wider stakeholders, but we're trying to make sure that they own the results, but at the same time the results are public, and that's quite challenging for many departments because some evaluations have been done in South Africa, but they're usually not made public. So departments will gatekeep on the results, and if they don't like the results, those results may not come out. So they can't do that anymore. So there's an issue there. So we probably wouldn't do any dissemination during the evaluation because there's a political management process that's needed around the results. But what we will do is make the terms of reference available at the beginning publicly, so people do know that these evaluations are happening and can then put pressure on the departments about, well, what's happening and around that. And so the responsibility for dissemination is primarily with the department itself, but we will play an active role to make sure that they don't. So, for example, what's happening is sometimes the departments are contesting the evaluation and they don't want to take it to Cabinet or the Parliamentary Committee. In that case, we're going to take it. So that we're saying to the departments, better if you do it, but if you don't do it, we're going to do it. So that they can't avoid the uncomfortable findings. But, it's not a simple process.
Interesting. Kimberly, I'm sure you have comments on the issue of best practices to which Margaret referred, and the issue who has responsibility for both the use and dissemination.
At the Institute of Medicine, sponsors don't necessarily have a choice about whether the findings of the evaluation or the report are disseminated, whether they like them and agree with them or they do not. So I would say two things about that. We have a primary responsibility in terms of, again, the basic activities that we agree that we're going to disseminate to the sponsor if there are congressional agencies involved, and really trying to focus on working with the programmatic staff. And it is often up to the sponsor to determine what will happen in terms of dissemination beyond that. And I think for this evaluation, some of the goals that we had for the dissemination plan were very broadly, how can we make sure that the findings are available for program and initiative improvement looking forward. Also trying to contribute to the state of the science in terms of evaluation and use of mixed methods at this large scale. But there was also another component that I just want to mention here, is that we also felt like there was an educational component for the U.S. public, because there was not a lot of knowledge about PEPFAR and what the program is actually doing and how taxpayer dollars are being spent. So those were some of the primary goals of the dissemination plan and why we sort of packaged activities the way that we did. I think it's a real debate about how evaluators can support the use of the findings, and for us, I think it depends on the structure that you have as an evaluation contractor. And if you're able to go out and continue to do any of the dissemination and try to translate results and try to influence those practices. And for us, I think that we are very limited in how we do that. But we also have the flexibility within our structure. If you can find a way to continue to link those findings of an evaluation to some other salient activities so that you're building on opportunities to disseminate and opportunities to translate use, and this workshop is a great example of that, then I think in that instance, IOM as an evaluator played a role, but I think that it's sometimes very limited depending on the type of contractor you are to be able to make those decisions.
Just a quick one.
Just a minute. We have a couple of questions. You can add your addendum when you reply. Let's have, please, Rachel, and then Rachel, and then Karen. No, you're included in the Rachel first, then my colleague it back, and then you third. Okay. Go ahead, Rachel. Go ahead, please.
Thank you.
Please.
Some of this has been touched on, especially by Ian just now, but nobody's talked about independence and the degree to which the evaluation is an independently requested one. And I, looking across the panelists, clearly the IOM, by virtue of what it is in the U.S., you've done a very independent evaluation all the way over to the PMI, which was internally derived and driven, as I understand it from Bernard. And Ian, it seems as though the structure you've set up there in South Africa is right in between. The collaboration, the partnership in funding and in doing it gives a certain amount of independence, but also a great deal of obviously participation. And then I think the AMFM is a very different thing too, and with its own peculiarities in a way, and how it was carried out. But I'm just interested in people's reflections on what that implies then about the usability and how it's used. And we've already talked about whose responsibility it is to disseminate, but really I think there's a big implication in terms of how it's used in that independence.
Martin, and then finally.
Sorry, I didn't identify myself. I'm Rachel Nugent from the University of Washington.
Gosh, I thought everyone knew you, Rachel. Martin, and then Cara for the last question.
Yeah. Martin Vassen from ICF. I would like to make the point that in dissemination, one of the most difficult thing really is to identify actionable policy implications. And that's even more important because of what Mr. Goldman just said, the difference between talking on behalf of, say, a large program and the program as such, or in talking on behalf of the countries. And certainly when we talk on behalf of the countries, whatever is said at the central level needs to go at the country level, needs to take into account all the realities of funding, priorities, God knows what, in order to see which results actually constitute actionable recommendations for that particular country. And it's really something that I feel, talking about DHS experience, where we have umpteen dissemination activities, is the most difficult part of all, because it's not in the hands of the evaluator.
Thanks very much. Kyle, last question.
Yeah, just sort of a comment again about who has the mandate for dissemination. So I'm interested, so Bernard said he felt very much that the evaluated has the mandate, and maybe that is true in some evaluations. I think in the case of the independent evaluation of AMFM, it was rather complex because you can't always leave it to the evaluated, because if they don't like the message, they might not be interested in disseminating it. So it can't be up to them. But these, the results of evaluations are political. They end up in the political domain, and certainly we did see that here in the UK with very active dissemination of some of the evaluation messages by UK-based NGOs. And so, and I think the question of who manages that process, is that up to the evaluated? Are they in the right position or the best position? I'm not sure. If not, then is it the evaluators who are responsible for managing their message to make sure that their message is received clearly and is debated fairly? So I think we can't really escape from the political element of evaluation findings, whether those are of national programs like a preschool program, or whether it's a global health initiative. And I think we can't shy away from that.
That's the reality, isn't it? Yeah. Bob, last question.
Bob Black, Johns Hopkins. I think going a little beyond the dissemination of the findings of the report, I think we're in an age of, I hope, increasing transparency about the evidence on which recommendations are made. So I guess my question to the panelists would be, to what extent can we, should we, make available the evidence base upon which the reports are based, respecting confidentiality, respecting restrictions that might be placed on those data. I guess for two purposes. One is the understanding and potential replication of the findings, but also additional use of the information beyond what was able to be done during that particular evaluation. I think all of these evaluations have collected a rich database. To what extent can that be utilized?
Good. I'm going to ask you, the panel, to react. Each one doesn't have to react to every question, but those particular questions. The independence one is very, very, very critical. The diversity of audience is another one. Responsibility for dissemination is another one. and the need for transparency of evidence and the availability of that evidence. The availability of evidence had been an indication of the transparency in the process. You'd like to begin? You don't have to answer every question, respond to every question.
Well, yeah, I think the issue of independence is an interesting discussion because I think, you know, what is the definition of independence actually? And I think some people may think that the evaluators are off in their own world, and if they have any sort of interaction with those who are being evaluated or who are going to be recipients of this somehow, that might compromise their independence. I can say from the PMI side, it was quite different because, again, we wanted this evaluation. We obviously didn't want to evaluate ourselves. We wanted some folks who were not recipients of PMI funding to actually look at what was going on. But also there was quite a bit of going back and forth, as John sort of putting the team together, because I wasn't involved in that, but I understand that there was a list of some people who could have been on the team were taken off because they, at some level, were potentially could have a conflict of interest or a perceived conflict of interest just because they had received funding from here or there, and no matter how technically sound and how qualified they were not on the team. I think ultimately there was a very good team put together, but that was a process that took a couple of months just to put that team together. So that, I think, further helps assure some of the independence. But, you know, we didn't, you know, we did get a copy of the draft report, and it's almost how we work with our inspector generals. You know, we get a copy of their report from a particular program or country X, and sometimes they get it absolutely right, things we weren't aware of, and sometimes they don't know the sort of contextual factors and others that they somehow missed, and they actually come to us and ask us for what we think. They can ignore what we think or not, and that's what happened with this evaluation. The draft report was shared with PMI. We looked at it. As John said, we gave some feedback. They accepted what they thought was relevant, and the rest of it they just ignored, and that's they're allowed to do that, and we respect that. So I think the issue of independence, what people perceive as being independent, I think sometimes there may be a danger of being so independent that you may end up with stuff that's not actionable because you don't actually, anyway. And I think that may relate to some of these discussions around use and then what you're going to do. Having some sort of it helps the evaluators, I think, to have a better insights into what the audiences are and what people are thinking about. So,
can I just make one clarification? We didn't ignore any comment. We actively rejected some.
Yeah.
And I actually think that's an important distinction because each of the 82 comments, it's John Simon, and I'm just adding to that, the feedback was on multiple levels. Factual accuracy, getting somebody's name spelled right. That's a very useful feedback, not just a name, right? But the important thing is that nothing was ignored, it was considered, and if it was not incorporated in the report, it was an active rejection.
Okay.
And I think that's actually the part of the independence.
Yes. Now, Dorothy? I'm sorry, were you through?
Well, no, just a question about transparency. I think there's different levels of transparency. Part of it is the qualitative side, and I have no problem if people want to see a list of, well, so-and-so said this about so-and-so, or which is what part of this is, like sort of people's perceptions of the overall model. But that's a bit different. I won't go into impact evaluation or coverage issues, but a lot of that, the coverage stuff is based on, Martin's just left the room, but is based on DHS and mix and so that is available. The impact evaluation is a different thing, and I think at some point in time we should have a discussion on impact evaluation because ultimately that's what all these global programs are about.
Okay, Dorothy.
Yeah, I'll sidestep, and there was the question around how evaluators can help, and the IOM has not asked me to do this, but I found this a really, really helpful summary and piece of work that if you're looking at what evaluators can do to help in making the results usable and actionable, then this was a good example of how that can work. In terms of, and I think linked to what Martin had raised about actionable recommendations, I think being very transparent even about the terms of reference of the evaluation, and just even little details like the reviewers and so on and so forth. All that, I think, just builds the feeling of that this evaluation is solid. It's based on, it's transparent. It's based on evidence that even when the findings or recommendations may not be exactly palatable, but they are real, and that's what it is. But so the fact that it's the solid grounding, then it makes it easier.
Thanks. Yeah.
I want to challenge you, because I think I hear a lot of northern technical experts talking about how they're going to communicate to the south, and I think you just need to change your debate. If you want change, then you need to say, what's our partnership model? And I think you need to start from that right at the beginning, okay? And so it's not about, people who've been in agriculture know very much about the technology transfer models and et cetera, et cetera. How do we move beyond that? So I think you're in a technical debate which has value, but it's of limited value. And the issue is really how you contribute to a change process. And there's a great danger of UN and the types of organizations that you're linked with, but just becoming another neo-colonial model, yeah? Where you use your power and your money to tell us what to do. Mm-hmm. So I think you need to change your paradigm. Mm-hmm. So just in terms of the independence issue, I think that relates to it. So I think I think exactly the point that's being made is this balance between independence and usefulness. And yes, get an independent provider to do it, but they need to involve the people who are involved in the process. They'll give a very ill-informed, and particularly around recommendations. So, I know there's quite a lot of debate about whether evaluations should give findings or whether they should actually give recommendations, because obviously in many cases they don't actually understand well enough the implementation reality to be able to give a very strong. Actually, what we're doing at the moment is trying to work quite heavily on the recommendations, because it is helpful if we can get to Cabinet with something that's useful. Mm-hmm. So we're working in one evaluation that I'm working on, which is very strategic, is about the coordination systems of government. I'm rewriting the report, not to change the findings, but to make them powerful and to make the message come through very clearly. And because if it doesn't, it's not going to have an impact. Just one thing, Pat, I forgot to say earlier, is we're planning an evaluation of evaluations, because our view is this system is costing money, it's costing time, and it's got to make a difference. So in 18 months' time, we're planning an evaluation to see whether the evaluations have actually made a difference. And if not, we'll downgrade the emphasis that we're putting on this.
Okay. That would be a meta-evaluation.
I would just want to say something about independence and the political element of findings, and the fact that the IOM is extremely independent but doesn't feel that prohibits use or utility of its findings. I think for this particular evaluation, the difficulty was in the duration of the evaluation and the periodicity, and that there was not continual communication, because our processes didn't actually allow us to be able to do interim products that might help for program improvement. It was, this is happening, it's going to take us 4 years, and then we had a lot to say at the end of that 4-year period. The other thing is that there's actually, just because the study was mandated, there's no requirement actually for use. There's no requirement for there to be adoption of any of the findings and recommendations by the Office of the Global AIDS Coordinator from the Institute of Medicine. So that's a really interesting sort of dynamic, and it's like most of the time people want to come because of the IOM report and the IOM stamp and the actionability, and how we actually try to go forward and actually make actionable, realistic recommendations, because we have guidance within our institution that says your recommendations must follow this sort of pathway. So I think that that's interesting, and ultimately to us the accountability for use lies with, some would say lies with Congress, that they will actually expect some sort of change, whether it is in terms of program improvement, initiative, or how the program is funded, or whether there is reauthorization legislation or not reauthorization legislation. That's where a lot of that decision-making sits, but that's for this particular evaluation. And the tie to the political elements of findings and the expectation and hope that there's a good political story, I think that was certainly true, but a surprise to us was that we found that this evaluation was used to create more bipartisan support for this initiative in general. The initial authorization was in a very different political climate than the time for reauthorization. So while we didn't have to really talk about dismantling or changing the legislation, which is really the focus of the first PEPFAR evaluation that IOM did, the ambassador actually used it to create a bipartisan coalition to get other people and members of Congress to actually look at what this program had done, and did they really sort of want to dismantle it, which is not what any of us anticipated how this report would be used in terms of a political benefit and how it was tied to the findings. So.
Okay, yesterday afternoon I felt very badly because Elliot told me I'd taken his name in vain. And I'm going to say a mea culpa, Elliot, and ask if you would like to make a comment. What is it? I say mea culpa.
This is called getting your own back. I was thinking how very specific. One of my both vices and strengths is that I visit different evaluation communities, and each one has a very particular discourse. And I was fascinated this morning to hear a very particular approach to dissemination. It did strike me a little bit the way Ian described things as quite a top-down kind of approach. One could call it neo-colonial. One could certainly call it expert-driven, because the medical and health type evaluations tend to have an assumption of authority and an assumption of our job is to tell people the way things are and should be. I do think that there would be great advantages to those of you who are involved in these kinds of programs to talk more widely within the evaluation community about different strategies for dissemination and engagement, which would perhaps enlarge the repertoire of the sorts of things that you contemplate. But it's been very enjoyable to watch other people work so hard.
Well, let me first of all thank you all very much, and the chairman's privilege. Bob, I'm going to take it as a given. Since no one commented negatively, I think they all agree with you. That is a fundamental aspect of the whole process, that the evidence on which the recommendations are made should be in the public domain for point of responsibility, and also for the possibility of replicability. And the last point I would make is that when we talk about the dissemination, I think it was Kimberly who mentioned that much of this was done voluntarily by their staff. It's obvious from listening to the four panelists that the ingredients for success dissemination is passion. And obviously we had at all four of those, the passion to get their work done. So let me thank you all very much, and I'm sorry I ran it over time. Thank you very much. Yes, thank you very much.